Okay, so let's start from review. From last class, I think some students missing last week class. We just do some quick review for last class. So we are West diagnosis. We are not TCM diagnosis. We say basically physical diagnosis. Basically, physical diagnosis. Generally, we say we separate with this part. Yeah, that's basically in our class. So we just try to do compare with TCM diagnosis. So when we say TCM diagnosis, I think some students take TCM diagnosis already. You say we have 4 ways to make TCM diagnosis. So we have looking and hearing or smelling and ask a question and palpation. That's felt pulse included in here. Yeah, that's we say TCM diagnosis. We have 4 ways. 4 ways. That's mainly the first part of TCM diagnosis. Generally say, we pick up the information from the patient. Yeah. From looking, from hearing, from ask a question, from palpation, mainly for the pulse. Take the information from the patient. So what's the West medicine diagnosis? Basically, we do the same thing. Yeah, basically we do the same thing. Maybe we just put the order, little bit difference. Yeah, we just put the order, little bit difference. We still ask questions, inquiring. That part we also call history talking. Yeah. Talking about the history of the patient illness. We still have looking. We still have palpation. We still have hearing, but a little bit difference here. Looking pretty similar. Yeah, looking pretty similar. But for TCM looking, we may look in the face, look in the tongue for the colors. But for West medicine, we looking, maybe we looking the patient's skin and looking the patient's walking in way and lay down way. So that's some difference. Some difference. So palpation. Yeah, palpation for the TCM. We mainly part is palpation the pulse. But for West medicine, we have a lot of air of the body. We need palpation, especially for abdominal area. We have a lot of organs in abdominal area. We need palpation. Like we find the organs. Yeah, we find the organs. How big of the organs and the location of the organs. Thus we go to palpation. And then we talking about another one, hearing. So hearing for TCM, basically we hear the sound coming from the patient. This directly use our ear. But for West medicine, we use a tooth. We use scalp. So in this classroom, I couldn't control for your mic. Yeah, this classroom I couldn't control your mic. Someone pay attention, close your mic. Sometimes some sounds coming. Yeah, just turn off your mic. I couldn't control. Yes, thank you. Yeah, other classroom I can control, but this classroom I couldn't control. So that's hearing. Yeah, hearing. So we need a special kind of scalp. I believe everybody familiar with. It look like mostly look like this kind of shape. Yeah, this kind of shape. Scalp with hearing the sounds coming from the patient. Generally we say hearing the sounds mainly coming from the heart, and also possible coming from the lung, respiration sounds, and heart beating sound. Also, some special kind of situation, we also can hear the sounds coming from like blood vessels. So that's hearing. Yeah, that's hearing. It's not directly with our ear. We need a tools. Yeah, we need a tools. So that's basically we compare Western diagnosis and TCM diagnosis. Certainly, in Western diagnosis part, we also have some other way to checking for the patients, like laboratory checking and some others like X-ray, CT, or ECG checking. So that part not including in our class. We just go to the physical examinations. So basically, just this part. Yeah, just this part. And for TCM, certainly after pick up the information, then we make the pattern. So that's we say generally we talking about the difference with the diagnosis and with TCM diagnosis. So for TCM diagnosis, we say we have 4 ways TCM diagnosis. Yeah. For Western diagnosis, we still pretty similar there. But generally say we separate the 2 parts. One part we say history taking or healthy history. That's basically just ask a question part. Ask questions. Then we go to physical examinations, like looking the patient and hearing with the scalp, hearing some sounds, and the palpations. And also we have a special way we call percussion. So percussion last week we talked about. Basically we use our fingers tapping the patient's body, and then we hear the sounds coming from the patient. When we go to physical examinations, we will go to detail about it. But right now, we know percussion part let be special, compared with TCM diagnosis. So that's generally we say we separate two parts, healthy history. So that's we talking about last week. We also talking about little bit today, 2 weeks. Then we use all the time for physical examinations later. So certainly, whatever the information we take and what's the information coming from the examination of the bodies, we need a recorder. So the recorder, you can follow, like ask questions same time, and then you record it. And you also can do it after, especially for physical examination part. When you examine the patients, maybe you don't have time to record. You can finish it and then you record it. But truly you need a recorder. Truly you need a recorder. Then we go to the history part. We say ask a question. Ask a question. So ask a question, we have the order and we have some special question we need to ask. We say the first one we certainly need to ask patient's chief complaint. Sometimes we just use double C. Chief complaint means the patient looking for the treatment mainly, what they try to looking for. And the second one, anything relationship with chief complaint, personal illness. And the third one, past history, means patient possible have some other issue, but not directly with relationship with chief complaint. And then we talking about family history, like a family member have some illness. Then personal and social history, like people smoking, drinking for the period. And finally, we ask a lot of questions, follow the systems. So basically last week, we finished the first 5 parts. And today, we mainly focus on the reviewed systems. So that's just some detail here. Just some detail here. Before we take the information, like we say, we ask patient chief complaint first. But before we take the information, usually in the clinic, they will have a form. And on the top of the form, some more general information will be there. You can ask the patient to fill that part. You are not necessary to ask. So that's including like name, gender, aging, contacted phone, and occupations, and married status. We ask occupation because some illness may be relationship with their job or working. We ask for married status because some illness may be relationship with like a married states. For example, some sex transmission kind of illness. So that's basically information on the top of the form. Then basically the form will put the chief complaint in there. And then history in here, history of personal illness, history of past illness. Basically, you just put the information in the same part, will be okay. Yeah, will be okay. You are not necessary each time you write down like a chief complaint, history of personal illness, or history of past illness. So basically the space for chief complaint is pretty smaller. Yeah, pretty smaller. So that means in chief complaint, we just put mainly key symptoms there. Maybe just one or couple of them. Yeah, maybe just one or couple of them. Not too many. Yeah, we try to pick up one or two more important symptoms put in there. Don't put the illness name there. Yeah, don't put the illness name there. Just put the symptoms. Yeah, just put the symptoms. And also you can put the date, like a time, like 2 hours or 3 days. So something like that. Pretty simple. Yeah, pretty simple word. Like a headache, 2 days. Pretty simple there. And certainly, yeah, certainly we need more detail. More detail put on the personal illness part. Yeah, more detail put on the personal illness part. So that's chief complaint and the personal illness. So that's we say anything relationship with chief complaint, detail go to personal illness. And then patient maybe have other illness, but not directly relationship with chief complaint. Thus we put to the past illness. Like a patient have some surgery before, and the patient take some medication before, like a high blood pressure for 20 years. Yeah. But this time, the patient coming with stomach pain. Nothing directly relationship there. We put for the past illness part. So that's generally speaking in this part. Then we go to family history. Yeah, family history. So family history part, we're talking about blood relationship kind of family members. They may have some special illness, and if they die, what caused death, like parents, grandparents, fathers, sisters, even like daughters, yeah, some family members, they have some severe kind of illness, like hypertension, like cancer, or heart disease. So severe kind of illness in family members, we need to record. Because some illness truly relationship with families, yeah, like a genetic problem. Then we go to the personal and social history. So that's basically we talking about some people's lifestyle, or maybe they travel to some special kind of area or country, and their job, they're drinking, they're smoking, and menstruations, so something like that. So that's basically we say last week we talking about, we finished 5 parts. And finally we review of the symptoms. So review of the symptoms, basically we follow the body symptoms. We talking about, we ask a question, still ask question, from top of the head to the bottom of the toe. So some detailed question in there. Before we go to there, we're talking about 2 words. So 2 words, we're talking about one is the symptoms, one is the signs. So symptoms, symptoms means the patient itself can feel it and then they tell you. So that's usually coming for teeth complaint. We say we put the symptoms there. We put the symptoms there. For example, patients say headache. Headache is the symptoms. Patients feel it. But other people maybe couldn't see it. Sometimes we can see, sometimes we couldn't see it, but truly, patient can feel it. That's the subjective kind of information in there. So that's, we say that belongs to symptoms. And the signs, signs. Signs is the doctors or practitioners through the checking or examinations, then find it. That's the sign. Like patient blood pressure is high, or maybe some part of body they have skin rash. We can find it. We can see it. So that part we call signs or objective candidate. So that's, we are not confusing these 2 words. Some people, sometimes when you, I think when you like over the line and you log in again, checking your microphone, turn off your microphone, Sometimes you're losing the connection and maybe you connect it again and your microphone may be automatically open. Checking everybody's microphone there. Sometimes your microphone makes some noise. Oliva, are you in there? Your microphone is open. So I say in this classroom, I couldn't turn off your microphone. Thank you. When you hear some noise, just checking your microphone. Sometimes your microphone may be open. So that's for the symptoms and the signs. Symptoms and signs. So here is just some detail here. Here's some detail here we talked about last week already. Even you are not in here last week, you still can see some explanations, but basically explanation I will talk about already. So still just some detail, yeah. Which question go to which part? Yeah, which question go to which part? And then we go to the part review of the symptoms. So this part we didn't talk about last week. Yeah. So we say the last part we ask question, or the number 6 part we ask question is a review of the symptoms. Review of the symptoms means we ask question from the head to the toe. So that's basically we try to not missing any of the information. Like we start from the head. We ask some question about the ear, about eyes, yeah. So like how about your ear and hearing? And how about your eyes? Do you have some dry eyes? Then go to the neck, then go to the lung and the heart. Then we go to digestion. Then go to the bowel movement. So basically we follow the order. We say from the head to the toe. Go to different part of the body and the different systems of the body. So that's generally we say review of the symptoms. So then we go to some detail here. Then we go to some detail here. So we are still in the review of the symptoms. The last part, we ask questions. So general questions, yeah, general questions. We can ask a patient about body weight. Certainly, that's still possible in the examination or checking part. But we ask questions here, mainly we focus on the weight changing, especially is recently weight changing. Like some people losing weight, like a cancer kind of patient, they losing weight pretty fast. So we ask the weight changing. Sometimes patient may say, I didn't weigh myself, I don't know. But I felt my clothes, yeah, it's more loosening than before, or more tight than before. Certainly losing, yeah, clothes is more loosening, that means patient losing some weight. If clothes more tight, means the patient getting some weight. And the other information we can ask patients if have some fatigue or fever or generally weaker. So that belongs to general information. Then we ask patient about the skin. Yeah. Especially have some special area, maybe have skin rash in there. Maybe have some lumps in there. And maybe itchiness, maybe dryness, or maybe even color change. That's the mainly things, or maybe sores in there. So that's generally in the skin and maybe in the hair or in the nails. Superficial of the body, yeah, superficial of the body. Any changing, yeah, any changing in superficial of the body. That we ask. Then we say we start from the height. Yeah, we start from the height. So head questions, the pretty common one, headache. Yeah, headache, dizziness. Yeah, or maybe have some injury before. So that's the common questions. Then we go to the orifice questions. Yeah, orifice questions. We go over it one by one. Yeah, go over it one by one. Start from the eyes. Yeah. You can start from the ear, still okay, but just go over it one by one. Yeah, order here is not that important. For eyes questions, yeah, eyes questions. Certainly, mainly is the vision. Yeah, mainly is the vision question. Yeah. How about the vision? Yeah. It's clear or decreased, especially recently decreased. And if patient have glass, yeah, patient have glass. And if patient recently examination for the visions, and possible have some eye pain, or maybe patient always have tears. And the vision problems also possible, double vision, blue vision, spots inside the eyes, flashing lights. Glaucoma is a special kind of eye problem. Cartilage is another special kind of eye problem. Basically, these two problems will be caused patient vision decrease or maybe totally losing vision. Thus, usually patients go to eye specialist and then they can get a diagnosis, which is recorded. So that's for the eyes questions. Then we ask for the ear. Yeah, ear question. Ear question mainly is hearing function. Yeah, hearing function normal or decreased. Or some patient maybe have tinnitus. Sometimes people pronunciation for tinnitus, yeah, the same thing. So that means some abnormal sounds go to inside of ear. Yeah. And the patient maybe have vertigo. We know the ear have two functions. One function is hearing, another function is the balance. So that's why we put a vertigo in West medicine for the ear questions, because the balanced relationship with the ear. And the other question relationship with the ear, like a ear ache or maybe some discharging. So that's usually we ask a question relationship with the ear. Then we ask question about the nose. We say orifice, yeah, orifice. On the head, eye, ear, nose, mouth. The nose, usually the question stiffness, yeah, stiffness, and discharging, yeah, discharging. So that's the common question, or maybe some people have itchiness, yeah, itchiness, and they will easily get allergy, high fever. And especially some people may be bleeding. and they may have sinusitis problems. So that's the nose question relationship. Then we talking about the mouth or throat questions. That's including the teeth. Yeah, including the teeth. Yeah. How about teeth? Like some people early age losing some teeth. Yeah. And the gums. Yeah. Some people have some ulcers on the gums. And or maybe easily bleeding gums. And some dentures on the teeth. And then if they fix which one we record it. Yeah. And also people maybe have some tongue problems and dry mouth, sore throat, some kind of problems, and sound problems also. So we just ask question, and we say we record it, and then later on we will think about that maybe relationship with the patient's illness. So when we finish question on the head, we moving to the neck. Yeah, we moving to the neck. Neck, we don't have too many questions. Neck, we don't have too many questions. Usually, neck problem is the lumps. Swollen glands. We know all thyroid glands located in the neck. Usually, when we talking about swollen glands, we talking about thyroid glands. Yeah. So that's the illness of thyroid glands. And also, patient maybe have some painful or stiffness in the neck. So that's the neck problem. And usually. Then we moving ask question. Yeah. Remember, we are still in the ask question part. Later on, we will talking about examinations the body. We still from the top of the head and go down to the bottom of the toe. Don't confusing. Now we are in the ask question part. Ask question about breast. Yeah, about breast. Especially for the female. They may have some trouble in the breast tissue, like some lumps there, or maybe some painful in there, and possible some nipples discharging, and ask patient if they do self-examinations itself. The way to self-examinations for the breast tissue, we will talk about later when we talking about the examination part. But here we just ask the patient's question. If they checking it breast tissue, basically we expect it regular, like every week. Then we say we follow the symptoms, yeah, review of the symptoms. Now truly we go to the big symptoms, respiration systems. The question relationship with respiration systems, we have questions like if patient have cough or maybe phlegm, yeah, phlegm, and if they have phlegm, we will ask about what kind of color in there. Yeah, what kind of color in there? Like a yellow color or white color. And quality, yeah, means sticky or thinner. And possible some blood inside. Yeah, if blood inside, or patient have other symptoms, maybe short breath and visit. And also maybe pliers problems. And if patient do some X-ray checking before, and what kind of illness the patient have before, like asthma, bronchitis, pneumonia, yeah, tuberculosis. Yeah. So that's a lot of lung illness relationship. So that we follow the respiration system. Then we go to the cardiovascular system, or also we call circulation system. Cardio means heart. Vascular just means blood vessels. So basically, in this part, we ask a question about heart. Any kind of heart trouble before. And if patient have high blood pressure and some other heart issue, or maybe chest pain and palpitation. Still, heart illness still can cause the patient like difficult breathing, severe kind of short breath, or maybe edema. For West medicine, let be different with TCM. TCM, water disorder, we are not thinking about heart. We're thinking about the spleen, or maybe lung or kidney. But truly for West medicine, we're thinking about heart. Because heart losing function, bumped blood go to all over the body, and losing function receive the blood, return back to the heart. That's cause the water retention. That's cause the edema. And also when they checking their heart last time, and what's the result? So that's the general question relationship with the cardiovascular system. Then we move into digestion system, gastrointestinal. Still two medical words together. That's the stomach. That's the intestine. Intestine basically the same. So digestion systems, If patient have some trouble to swallowing something, you're eating something, and heart burning, that's basically we call it heart burning, but truly caused by stomach acid, sometimes acid reflux. And how about the appetite? If patient have some nausea or vomiting, how about bowel movement? And what's the color and the size of the stool? Like patients say, I have stool like 3 times daily, but each time is small amount. And changing the bowel habit means usually people got bowel movement in the morning, but for some reason they go to afternoon. Or maybe some bleeding coming from the stool or coming from digestion systems or black stools. We say people have bleeding in digestion systems close to the arms area, large intestine. You can see the blood mixed with the bowel movement, mixed with the stool, if coming from large intestine. If coming from the arms around the rectal area, that's just fresh blood, not mixed with the stool. Maybe before, most after bowel movement. But if the bleeding coming from upper digestive systems, especially like stomach, they passing stool will be black stool. You will not see the red color in there, but still is bleeding. And also hemorrhage, and constipation, diarrhea, and some other questions, abdominal pain. So that's generally some question about digestive systems. And also people, especially have jaundice. So remember, liver and gallbladder provides the medicine belong to digestive system if the people have this kind of trouble before. Then we go to urination systems. So urination systems questions basically about urine. How frequently urination, and the amount of the urine, big amount or small amount. If patient have night urine. So generally say young people will not normally will have night urine. For aged people, maybe just once, that belong to normal. More than once, still abnormal. And the patient need urgent to go to urine, still is the trouble, like bladder infections, and the burning sensation or painful during the urine, still mainly coming from like urination tract or bladder infections, and even some blood in the urine. And the patient possible have history about urination system infections, and also kidney stone. And the patient couldn't control their urine. So that's some questions relationship with urination systems. Then some question relationship with genitals. For the male, like a hemorrhage, and some discharging, coming from penis. And also we need to ask some history about sex kind of transmission kind of illness, and if they got treatment before. And also including some sex kind of habit and their functions, and HIV that belong to the illness, the sex transformed kind of illness. For the female, we still have a lot of questions. That's basically even more questions here. So for the female, mainly question go to menstruations, the aging, if it regularly or not regularly, the time, and the duration, the period, and the amount of the bleeding. If have some bleeding between the periods, and what's the time of last period, and if they have some painful situation, and the PMI, like people have some emotions always before the period, and if the patient menstruation stopped, when is the age, and some symptoms, and some people menstruation stopped and then they still have some bleeding, that will be abnormal. And also we ask about discharging. So, or maybe some itchiness in there and sores in there. And also question about patient pregnancy history. How many times got pregnancy? And how many for delivery? And how many for abortion? And also we ask about birth control, which way? And we still ask the question, the illness relationship with sex transmission kind of illness, like HIV, or if patient have HIV before. Then we go to the questions. We say that's peripheral vascular. Peripheral means ending part of the blood vessel. Basically go to the limbs. Arms and legs. And most problems or trouble happens on the lower part of the limb. That means leg. So we ask patient if they have some cramping or blood vessels, veins in there, enlarged in there, or maybe some clots in the vein before. So that's some question in there. Then we go to questions to muscular, skeletal muscular systems. That's mainly is the muscles. So question about the muscles pain, or maybe joints pain. Muscles, muscular is the muscle, skeletal is the bone. So question about muscles under the bone, and the stiffness of muscles and some arthritis. The symptoms still joint pain, but mainly go to small joints. gutters last time we talking about. Yeah, still joints pain, mainly, and some other issues. And back pain. Yeah, back pain. So basically, if patient have kind of pain condition, we will ask detail about location and like how severe of the pain, or if some redness around there, and also maybe weakness in there, and how about the movement. So that's basically relationship with the muscles and the joints, some questions, and the special time for the symptoms, like in the morning or in the afternoon or evening. And the duration, like each time, it's painful, 20 minutes or maybe 5 minutes, and how severe of the pain, if need medication or painkiller can relieve it, or it relieved by itself, and if patient have some trauma before. So that's some question relationship with the muscular skeletal system. When we talking about basically something relationship with the nerves. So nervous systems, we have central nervous systems, we have peripheral nervous systems. So that's we say nervous systems. And the functions will be different. So some question in the relationship with nervous systems, like people fainting. Fainting means patient suddenly losing consciousness. That's a CNS disorder. Seizures, some spasm, and still possible losing consciousness. And weakness, generally some weakness, and part of body couldn't move. Thus, is not caused by muscles, it's caused by nervous system disorder. And also some feeling disorder, sensory nervous system disorder, or maybe losing the sensory functions, or maybe special air, tingling feeling or pain, thus may be relationship with the nervous systems, or maybe some trauma, or some movement, involuntary kind of movement. We will talk about some illness later, a relationship with some involuntary kind of movement. They couldn't control their movement. Basically, they couldn't control their movement. So that's some question relationship with the nervous systems. Then we're talking about blood system disorder. Mainly is blood disorder. So in the blood, we have blood cells. We have red blood cells. So blood system disorder mainly relationship with red blood cell and platelets. White blood cells sometimes still have disorder. So that's 3 blood cells. So red blood cell amount decreased. That's we call anemia. And the last semester we're talking about, we have a lot of different kind of anemia. And the people easy bruising or easy bleeding, that may be platelet disorder. Also in the blood circulations, we also have a lot of protein. Some of the protein, their functions, relationship with stop bleeding. So that's people have bleeding disorder, possible platelet disorder, possible protein disorder. So that's still in the blood circulation and located in the blood plasma part. And also, patient may be transfusing blood before and maybe have some reaction for the transfusion. So just ask some question. Relationship with the blood. Then we ask question about endocrine systems. Endocrine systems. They say we follow the systems and follow the part from the top to the bottom. So endocrine systems, we have a lot of glands. The easy cause the trouble, thyroid glands. Certainly people maybe have some other glands disorder, but mostly people easily got thyroid glands disorder. So thyroid glands control our body metabolism. And if patient has thyroid gland disorder, if hyperactivity, people always feel hot. If decreased functions, usually people will feel cold. So we ask about heat or cold questions. How people intolerance, like suitable for hot or cold. Or maybe patient have more sweating, excessive sweating, always sweating, whatever the weather, cold or heat or hot, they always sweating. So that may be thyroid gland problems. Usually is hyperactivity. And also people easily thirsty or easily hungry. That's maybe belong to thyroid gland problems or maybe like pancreas problems. We're talking about the diabetes. That still belong to endocrine glands, endocrine system glands. And the people have a big amount for urine. They drink a lot, immediately go to pee. They couldn't hold in the water inside. That's possible pituitary gland disorder. We have a special hormone control of urine. So that's basically different glands control different body's functions. So we have a lot of questions to ask about overall endocrine system. So then we ask about patient mental functions, mental functions. So that still belong to CNS, but that's special kind of CNS, like spirit disorder, yeah, mental spirit disorder. People always nervous, yeah. People's always emotions, and maybe depression, anxiety, even memory changing, and depressed cause people try to suicide, means kill itself. So that's basically belong to mental disorder. We ask a patient the question if they have some trouble relationship with mental disorder, and then we record it. Yeah, record it. So that's basically we go to review of the symptom part. Yeah, review of the symptom part. It's lot of question in here. That's together is number 6. Yeah. By the order is number 6. Yeah. If we go back from pretty beginning, we say history taking. Yeah. We are just in the first part of Western medicine diagnosis. First part is history taking. History taking will including the 6th part: chief complaint, personal illness, past illness, family history, and personal and social history. And the last part is review of the symptoms. We talk about lot of from the head to the feet, and including lot of symptoms: respiration systems, cardiovascular systems, and digestion systems, urination systems. So lot of symptoms. We have lot of questions there. So remember, history taking, just ask a question. We say the diagnosis, yeah, the basically West diagnosis, we including 2 big parts. One big part, ask questions. Second big part is the physical examinations. So basic ask questions, we finish here. Yeah, we finish here. We have lot of questions we need to ask. But these kind of questions, you can pick up important questions when you ask for the patient. And we put over other class, mainly focus on physical examinations. So we start some basic physical examination today, and then follow, we will get more detail about it. So that's we in this class, in this semester. So now we're moving to nose number 2. So we are in the basic physical diagnosis part, yeah, the class. So now we're moving to the examination part. Yeah. Generally all over. We're talking about what we will do examination for the patients. So that's for today's class. And we say later on, we will go to more detail. Yeah, we will go to more detail. So generally, overall physical examinations, we start from pick up some general information. Yeah, general information, like how the patient generally healthy state. So how we can see like a patient generally healthy or not healthy? We can see from the patient how high it is. Yeah, how high it is. So we say normal people. Yeah, normal people for adults is at least 150 over. I just say some like pretty low number here, but it still belong to normal. Yeah, still belong to normal. We don't have the high number. Some people even more than 2 meters. Still we thinking about normal. But some audios, I think some people see some audios like they're 20 or 30 years old. They only about 1 meter. Or maybe 1.3 meter in there. So that's truly abnormal. Yeah, truly abnormal. And then we see the body, not too thinner, not too bigger. Yeah. And also the sex development. Like the body development. For the female, the breast development. For the male, there still have some development for sex size. And then we pay attention, patients, like when we walking in or they sitting there, what do they look like, normal or abnormal. And also we pay attention if have a special kind of smell coming from the patient or coming from the breathing of the patient. So normally we don't have special abnormal smell in there. And also we watching for the patient's face. And watching like the patient's the active way. And hear the patient speaking if some abnormal kind of situation. So pretty similar like a patient is coming in, we just looking the patient, we get some basic idea. The patient is abnormal or normal. Yeah. So that's generally looking, pretty similar like our TTM. Yeah. TTM still, when patient is coming in, we got some basic idea. The patient have severe illness or just generally some uncomfortable in there. Then we talking about the vital signs. Yeah, vital signs. That's more important. Yeah, that's more important. Later on, we will go to detail there. Yeah, later on, we will go to detail there. But generally say, vital signs means more important connected with patient's life. Yeah. So that's including blood pressure. We will talk about like the normal range and the abnormal range, the blood pressure later. Yeah. But basically, we will talking the vital signs. including blood pressure, including the pulse. For Western medicine, usually when we're talking about pulse, basically we're talking about the rate of the pulse. We're still talking about later detail, like what's normal, what's abnormal. And also we calculate for respiration rate. We still have a normal range for respiration rate. And last one, we go to body temperature. So these four aspects together, we call it vital signs. Yeah, vital signs. We're talking about the signs before. That's truly the practitioner can see or maybe can measurement. So all of these four vital signs we can measure. Yeah, blood pressure we have special kind of machine. Pulse we can calculate. Yeah, and the respiration rate we can calculate. Temperature we still have meter. Yeah, we can still have meter to test. So that's totally together. We have four vital signs. So that's the vital signs part. But vital signs, different books, they may including the different part. But mainly part, we are not necessary to including the body pain. The mainly part we just remember four: blood pressure, pulse, respiration rate, and the body temperature. We're talking about the detail later. Yeah, just try to remember these four parts. Yeah, these four parts. Then the examinations, we start from skin, like all over the skin. And if some like skin rushing or damage in there, what's the color, and what's the hair and the nail. Yeah, we're still talking about the detail later. Yeah, we just got some basic idea here. Then we still start from the head. Yeah. Remember, now we're talking about physical examinations. Yeah. We're talking about ask questions from the head. Yeah. Now with physical examinations, we still from the head. Yeah, we still from the head. So we're checking for the eyes, and the ear, and the nose, and the throat. So for the head, we're mainly looking for the hair. We're looking for the scalp. And we're looking for the face. Yeah, this I'm looking there. Yeah. And when checking the eyes, yeah, when we ask questions, we ask about vision. We're checking the eyes, we're checking for the vision also. Yeah. And the vision field. Yeah. We're still talking about the detail later. Even we are not eye specialists, but we still can do some simple examination for the eyes. Yeah. Certainly, some more eye examination need to go to eye specialist, and they will have machine to check. But we can go to some basically physical examinations for the eyes. And certainly we can directly to looking the eyelids and the superficial of the eyes, scaled area, and the conjunctiva area. and the cornea of the eyes, and the iris of the eyes. So that's pretty superficially we can see. And the testing for the reaction to the light and the eyeball movement. So that we can do. Yeah, that we can do. Then we checking for the ear. The hearing function. Yeah. We can looking outside of the ear with our eyes, and we can checking some hearing function with the ear. So that's checking for the eyes and the ear. Then we moving to the nose and the sinuses. So we can checking outside of nose. Yeah. Just use light to looking. And looking the inside mucosa to see. Yeah. But better with some special kind of scope. Yeah. And we can palpation for some tenderness in frontal bone area and the maxillary bone area, because that's the two big sinuses located area. If patient have trouble with sinuses, they will feel tenderness there. Then we checking for the throat. Yeah, we checking for the throat and the mouth. Yeah. We checking for the limbs and the inside mouth mucosa there, and some gums, the teeth, the tongue, yeah, and the tonsils and the throat area. Just looking. That's mainly checking for the throat or mouth area. Then we moving to the neck. Yeah. Basically, we do the exactly the same order when we ask questions. Yeah, when we ask questions, systematic questions there, we still start from the height to the feet. Yeah. So now we're moving to the neck. So basically, looking, yeah, or palpation, if they have some lymph nodules there, and other masses there. We're talking about thyroid gland located in the neck area. We also can feel the trachea. Trachea should be in the center of the front neck area. So that's we also, and we can looking and palpation for thyroid gland. So remember, when we're talking about physical examinations, we still have 4 ways. One way is looking, provides the diagnosis. Yeah, physical examination, we have 4 ways. One way is looking. The second way is palpation. Then we talking about we have another 2 ways. Percussion. Yeah, we talking about the detail later. Percussion. Use the fingers to tapping the patient's body. Yeah, that's percussion. And aspirations. That means we use special kind of scope to hear the sounds coming from inside of patient's body. So in different part of the body, yeah, we may pick up a different way. Yeah. In neck part, we may only have inspection, means looking, and palpation. That's in the neck part. In other part, especially for the chest area, for the lung and the heart, basically we need all 4 ways to check it. So that's physical examination way. So for the neck, we only use inspection and palpation. Then we go to the chest area. We go to the back of the chest area. We're looking for the span. We're looking for the span and the muscles there on the upper back. Inspection and palpation in there. And also we also thinking about the lung and the chest cavity. So we especially looking and the palpation in there. We talking about for spinal and the muscles there. And we also can do percussion, like we talked about before, for the chest. We hear the sounds coming from inside the body. So basically, the sounds coming from inside the body. When we talking about the chest, So that look like the back of the chest area. And the big area inside is the lung. Big area inside the lung. And under the lung is the diaphragm. It's the diaphragm here. Under the diaphragm, right side is the liver there. Under the diaphragm, right side is liver there. Like we're looking from back of the patients. So that's right side, that's left side. So the sounds through the percussion will be different because the liver is the solid organ. And inside the lungs, there are a lot of air inside. So, like if we're tapping the patients in different parts, the sounds coming back will be different. So basically, solid organ, the sounds coming back more dull. And coming back from the lung is more hollow. We're talking about some detail later. But from that way, we can know like where is the lung, where is separate with diaphragm. And we also can use scalp, listen the breathing sounds, and some normal or maybe abnormal sounds. So that means abnormal sounds coming from the lung. And also we hear the sounds transmission coming from the lungs. Like we can tell the patient, say something, and then we hear the sounds. like we tell the patient say E, and then from the scalp, we can hear the sounds. In different part of the lung, maybe little bit different. So that's basically from the back of the chest area, we can hear the different sounds. So no worries, we will talk about some detail later. We just got some basic idea here. And then we go to funnel of the chest. We go to funnel chest. Funnel chest, we have breast tissue there. We can check for axillary area. And we also can check if we have some nodule there. So especially for women, checking for breast tissue. And then we checking for axillary area. So basically, when we're checking for axillary area, we're looking for some nodules under the axillary area. And then we're still checking for the chest and the lung. Inspection, looking. Both sides should be the same, pretty similar. The shape and the size, pretty similar. And the palpation, and the palpation. And the percussion and aspirations. That means lifting through the scalp. So we say we need a 4 ways checking for the chest, including the lung, including the heart. We hear some abnormal sounds coming from the lung. And we also hear the sounds transmissions. So similar like checking the back part. Then we especially go to, we say cardiovascular systems here, but we mainly checking for the heart in this part. So we checking for the heart, we still need 4 ways: inspection, palpation, and percussion, and lifting, aspiration. So basically, when we're looking the location. So we will talk about the detail later. Basically, we see the heart jumping in front of the chest area. And how bigger area, that means diameter. And how bigger it is, And the duration, the time. And we hear the sounds from the scalp coming from the heart, from the apex area, and also other area. Each of the area relationship with the valve. So we're still talking about some detail later. We know what means the normal sounds. So basically, normally we have the first sounds and the second sounds coming from normally heartbeat. So basically, they look like a dum, da, dum, da, dum, da, dum, da. These 2 sounds a little bit different, but that's the normal sounds. We still talking about detail later. And then we try to find out if they have some abdominal sounds. So that's basically we checking for the heart. Then we move into the abdominal area. So abdominal area, we still use full way to checking. So full way inspections, palpations, percussion, and aspirations. So that's full way for abdominal area also. And basically for other part of body, when we checking, we can follow the order. But basically for abdominal area, we can inspection first, certainly. But we moving the order. We put aspirations for the second. Then we palpation. Then we percussion. Yeah. So why we moving aspirations first? Because in abdominal area, we know we have lot of organ there, especially small intestine there, like large intestine there, they have lot of moving. If we do palpation and percussion, and then we do listing, like aspirations, the sounds may be changing. So means we not touching, we hear the sounds first, then we do other examinations. So that's especially for abdominal area. And for palpation, palpation we can separate with slightly or lightly palpation or deeper palpation. We do lighter palpation first, then deeper palpation. So basically we find the different problems in the different levels in the abdominal area. And also especially, we try to find the organs, liver and spleen. So basically, we checking both by percussion and palpation. And kidney. Usually we couldn't find the kidney. But if patient have kidney issue, like kidney infections, usually we can percussion on the back area. Still remember the location. Posterior area, like between the angle we talking about, that's the spinal, that's the rib here. It's an angle here, so that area, we percussion for that area, patient will feel tenderness or painful inside. So that's for the abdominal area. Then we move into the leg. So basically, for the leg area, that's including 3 systems there. We say peripheral vascular systems belong to circulation systems, and the muscular scapular systems, that's including the muscles and the bones, and the nervous system. So if we have trouble in the leg area, at least we need to think about these three systems. They may have some trouble. Yeah. Then we have a lot of tests for these three systems, and then make a basic diagnosis, like the trouble coming from which systems. But generally speaking, for vascular systems, we try to palpation to see if we can find some lymph nodules. And if we inspections, and some edema belong to circulation systems, and also some color changing or some ulcers that also belong to vascular systems. And certainly, when we checking for edema, we can look in and palpation. So put your finger there, like a patient has swollen ankles here. Put your finger there, touching. And after you remove your fingers, a big divot there, still keeping there some time. That means PT edema. If you remove your fingers, your skin recover to normal. That's no PT edema. And also we checking for muscular skeletal systems. So basically, we're looking if they have enlarging the joints, especially the shape change, and where it located. So we can check in or palpation the joints, and also checking the movement of the joints. So that belong to muscular skeletal systems. And for nervous systems, basically we're talking about how strong of the muscles, and also the sensation, like a sensory function and some reflections. And if they have some abnormal kind of movement, that belong to nervous systems. So still we talk about the detail later. Just some basic idea here. And we're still talking about checking about the leg. We can checking with different way. Like we can ask patient to standing there. Then for vascular systems, especially we watching for the vein. Big vein can show up. And checking the muscular skeletal systems, mainly we can looking the span and how they can move. And that's basically we can separate here. We go to nervous system first. So nervous systems, we looking the patient's like gentle and how they walking way. And also, especially for genital area, some people have hernia. When standing there, we can look in it. Yeah, we can look in it. Maybe lay down there, we are hard to look in it. So that's special. We're looking for lower back area, for the lower leg area, lower limb area, the leg. We can use different ways. So then we go to general nervous systems. Yeah, general nervous systems examinations. So general nervous systems examinations, basically we're talking about mental states. Certainly we have some detail for mental states. And we can check in for cranial nerves. We know everybody have 12 pairs of cranial nerves. Means the nerve branch directly coming from the brain. And we checking both motor function and sensory function. And we also can checking 31 pair of the spinal nerves go to all over the body. They still have motor function, they still have sensory function for different part of the body. And also we have reflections function. We still put later for detail. We have a lot of class later, especially for physical examinations. We just got some basic idea for today, like what in our class. And then we checking about the mental status. The mental status just generally mental, like the mood, and also we can like from the talking, like a patient answer the questions, and also the memories or attention, like focus the questions, patient can answer properly. And also we can test the patients like languages functions or even calculating functions. So some questions. For simple questions for memory, you can like the patient tell you like what's their name. Some patients have severe kind of illness. They may even forget themselves' name. Others, we can ask questions like, what are you eating in this morning? Yeah. And also like, how many children do you have? Where you live? So normally people can answer all of these questions. But people have memory disorder. They may forget. And the calculation function, basically we just give some pretty simple question there, like 1 plus 1 or 2 plus 3. Yeah. We are not give patient pretty big number there. Yeah. That's hard even for normal people to calculate in short time. So just a simple calculation question or memory questions. So that's basically for mental states. Then let's be detailed about cranial nerves here. So cranial nerves we talked about already. It's 12 pairs directly coming out from the brain, and mainly go to our head, mainly go to our orifice. It including the sensory part, including the motor part. So sensory part especially go to our orifice, like smelling functions or tasting functions. That's the sensory part. And the motor part basically is muscles movement, including the face muscles movement, and also including that's face muscles movement, including the eyeball movement, and including some reactions coming from the cornea. So we're still talking about detail later. So motor function, motor function. So motor systems still belong to nervous systems. Just the motor function here. So including mainly the movement, muscles, how stronger and how it movement. So that's we test. And the sensory function, or sensory systems, including the patient can feel pain, including patient can feel the temperature, like we put cold water, like a bottle, to the superficial, put the superficial to the patient's skin, and then patient can tell you that's cold or hot in there. They can tell you that's hot. Different part of the body. And also they can feel, tell them close to eyes, and they slightly touching there. They can tell you where you touch it, and some vibrations, and some movement, for the different kind of limbs. They can tell you. And the reflections. We have some basic reflections normally. We will talk about the detail later. That's normal reflections. Means normal people will have this kind of reflections. If they losing these normal reflections, that's abnormal. We have a lot of tests later. So that's basically picture. We're talking about the physical examination. And then after we ask questions, after we physical examinations, so basically we make a recorder. Like what we truly find. So basically we just can record some more important information, from the history taking, from the physical examination. For example, if we ask for like a patient review of the symptoms, we follow the cardiovascular systems, respiration systems, and the digestive systems. And each of the systems we still have a lot of questions. But when we record, if nothing wrong with some systems, like digestive systems, we can just simply say it's normal. It's normal. Digestive systems is normal. But we still record them. But if they have some trouble, we go to some detailed recorder. So that means you ask a question and checking question for digestive systems. If you say it is normal. If you not record there, other people maybe don't know if you asked or you miss it. So that's basically we record more important information and also important symptoms or important signs or symptoms. We still record it. But we just say it's normal or negative. So that's we record everything. So similar like our TCM, the patient's feel will keep it for long term. And like this time you treat the patient. Next time the other practitioners or doctor treat the patient. They will look in the patient history from the paper. So you are more clear recorder, they are more easy understanding later.